Hi, everyone. I'm Dr. Steve Chee. And today I wanted to talk about this question of could your emotions be contributing to your symptoms? So, a quick disclaimer, this is for informational use only. Please seek medical guidance that's really personalized to your unique situation. So, this question of whether or not your emotions could be contributing to your symptoms is one that I think is worth exploring. And now I'm not saying that all your symptoms are in your head or that's just quote unquote psychosomatic or something. Um, but it does make me wonder and about this point, which there's a saying which I've heard from two of my mentors, Doctors Ron and Mary Holick, some pioneers in the field of spiritual psychology, that how you relate to the issue is the issue. And this question kind of I can underscore that. So um, give you a little background. I just saw a patient and who has chronic hives. It's been on meds and seeing numerous specialists and getting treatment for it. And it's really very gradually, very, very slowly responding. So we were exploring her relationship with the hives. And I've also been trained in something called internal family systems. And one of their big questions they ask is, how are you feeling towards something? So we started to explore how is she feeling towards her body. And so when we asked her the question, she just immediately talked about her anger and her frustration and how challenging it's been and what it's done to her life, and all of which was completely and totally understandable. um, and but as we started to talk about it, she realized a few things. She realized she got a better understanding of the context of her life and why it was so frustrating, because she really was able to see that. And the other thing that came forward for her was that she realized that when she was really angry, that it was actually showing up as hives in her body. And what's fascinating about this for me is there's also this relationship in Chinese medicine with heat and anger. And that so there's a correlation with that. And so um, her having realized that gave her um, a better relationship with herself and her body. And this, I just thought this was an important point to underscore and share with you all, because oftentimes this relationship isn't always something, the relationship with one's body isn't always explored. And really finding a healing way of relating to it can really help and be really beneficial. So thank you for listening.